All right, so before we get started, I just want to tell you will get a CE credit tonight. We're going to take about an hour to talk about C notes. Just email us your AGD number, and you can email it to john@centricnotes.com. I know you probably don't have it in front of you. You probably don't have it memorized for sure. And I also am going to send y'all a post-course survey. I want you to fill it out, and please return it back just by email. It's real easy. And following the webinar, we're going to have a Q&A in the chat room for about 30 minutes. Any questions you might have about C notes, we'll attempt to answer. Today's program is sponsored by the Integra Institute. We're in the Institute tonight. It's PACE certified. Our provider number is 217594 for anybody who needs that. So let me tell you a little bit about who I am while we get started. And my name is John Schwartz, as you know, and I am a Christian. I have a beautiful wife named Ginger. I have 3 beautiful children. My life is wonderful, isn't it? I'm also a master ceramist, which is really rare in dentistry for a dentist to be a master ceramist. I'm 1 in maybe 4 or 6 in the country. I'm also an artist. I'm on faculty at the LSU School of Dentistry, the Department of Prosthodontics, where I teach aesthetics there to the prosthodontic residents. And I'm also director of the Integra Institute Center for Advanced Dental Learning, where we are tonight, as I said. And you can see the beautiful facility. This is a class going on. You can see what it looks like. This is our beautiful office where we work, where we stay really, really busy. And you might have seen my face before, maybe in some ads, or maybe on the cover of Dentistry Today. I always write papers on aesthetics and things. And if you want to see my latest paper, just Google Dentistry IQ Schwartz. And you're going to see the latest paper that I've written in particular about C notes. So it's be a good summation of what you'll be hearing about tonight. Because we are CE certified, I must tell you that we do have a vested interest in this, a disclosure. And also, we want to let you know that we will be talking, as I said, a little bit after in the chat room if y'all have any questions. So a little bit more about who I am. What I really love doing is making people look beautiful and creating beautiful works of art, of compositions, all day long in my practice. That's what I love to do most. And also, I am co-founder of C Notes with these 2 guys right here. We got Scott Hedrick on the right and Jorge Chow in the middle, and it's me on the left. What a great picture, huh? I love that. That's in New Orleans. We are based out of New Orleans, and this is a wall outside of a club that we love to hang out. So I want you to sit back and enjoy. If you have any questions, y'all can write them to us in the chat on the right, and also we won't be answering too many. I mean, as you write them in, we will try to address them, but if it's in the realm of what we're talking about at the time. If it's something unrelated, then we'll probably get to it later in the chat room. So what does all this have to do with digitization of the modern dental practice? We're making the world a better place, of course. That's what we want to do. But my goal today is to show you the system, and if you have the ability to get involved and learn it real well, you could be using it by tomorrow in your practice. But I want you to realize that this is just the beginning. I want you to take it slow and easy when we get going with C notes. So here's what I want you to know. I want you to know I'm a practicing dentist. I'm a wet-fingered dentist or a glove-fingered dentist. I want you to know that I do, when I do anything, that I do it to mastery. I want to get to the most detailed level of anything I do. I believe that the ultimate goal of dental technology is to reduce the complexity of daily activities. It's something called cognitive behavior. So I want to see you succeed in dentistry and in life. So today I'm going to give you some pearls, and I'm going to give you some secrets I said I would, and we'll talk about those in just a little bit. So what's the big deal about going paperless? You know, one thing about this webinar is we're actually not talking about being a paperless dental office. And my office is not a paperless office. You know, we print paper all day long, and I print dental notes all day long. I just happen to write them with C notes. And the thing that you have to understand about C notes is that they will, it will give you an incredibly detailed note. So this is not so much, what this product offers is not so much about going paperless as it is about giving you a detailed note that you couldn't write in the short amount of time that we write these in. When you get really affluent at writing C notes, 2 minutes tops is about what it takes to write a really nice note. And when I mean really nice, I'm talking a page and a half of detail. So that's the beauty of this. So just remember, it's more important about the note you write. I don't care if you're printing it or if you're integrating it into your practice management software, that's great. It's one step more to going paperless if you choose to do that. But C Notes is really about writing great notes. It's a note generating instrument. So what you're going to learn today, here's our pearls. I told you I'd give you 3 secrets to a highly successful practice and what makes my practice work. And I want you to realize that it's just the beginning for you. And also, if you want to implement this, if you choose to, I'll give you a $100,000 potential pearl that you can use in your practice. It's real simple, but you know, if you don't implement it, it won't be a $100,000 potential. So, and also I want you to utilize C Notes as part of your practice solutions, your everyday practice solutions. And if you can do that, and if we can accomplish all this tonight, then tonight's going to be a big, big success. So I hope y'all get it. I use these little Bitmojis in my lecture because you can't see my face, so it's that's kind of a fun little lighthearted thing. So are you guys ready to write some clinical notes? Do I have some yeses out there? Yeah, we get a few. Good, good. No, I don't want to write clinical notes. Clinical notes are painful. I don't get paid to write clinical notes. They scare the daylights out of me. What if I get sued? What if Mrs. Jones, you know, says that I'm doing poor work and it's not being demonstrated here? So clinical notes are a nightmare. They really are. That, you know, we were taught how to write them in dental school, but never a great job. And one of the things about this is that what we realize about why it's so painful is because these notes are essentially, they're non-gratifying to us. I mean, the only time you actually go back in there is when something difficult is going on. Of course, you review your notes before every patient, but for the most part, we as dentists, we know what's happening. We have a running total of what's going on with the patient, on each patient that we know, in our heads. So anyway, for 20 years now, digital technology for clinical dentistry has far outpaced the digital technology for clinical practice management. And you know, you can see why, because practice management is not as much fun quite as practicing, you know, with the latest implants and CAT scans and CT scans and everything that's involved in you know, creating implant jigs and all that kind of stuff to make practicing dentistry really gratifying and fun. So let's do a literature review. We're required to do that as CE credit. We have to treat this as a regular lecture. And so let's go ahead and discuss some things. In 2009, a Harvard medical study says that despite claims that health information technology could generate huge financial returns for us, computerized medical records are not improving the efficiency and quality of care that we as doctors perform. So what's the main reason? Their main reason, this is coming from Harvard, is saying that the PM software, the practice management software, is designed to primarily handle billing, accounting, and registration needs, and not clinical needs. So we got an issue here. What's going on? So there's a disconnect between the practice management uses of electronic dental records and what our actual needs are as doctors. So in 2010, the Journal of the American College of Dentists, Larry Emmett has an article. He's dentistry's high-tech guru. I hope y'all follow him. He's a very influential guy when it comes to tech, and he knows so much about this stuff. So he says electronic dental records in this paper offer fantastic benefits, saving both time and money, which they do. Okay, we have acknowledged that. But they have to be implemented fully with only historical records kept on paper. It's like, seriously, Larry? Come on. But actually, you know what's interesting? He's so brilliant. He recognizes that the limits of practice management software are right there at the clinical interface. So that's what he means, you know. Utilize what practice management softwares do best, and keep in paper what they don't do best. But now we have an option with C Notes that we can actually still keep it on paper if we want, or we can integrate. So Titus Schleier, if you don't know about this guy, he is brilliant when it comes to informatics, dental informatics. He understands what needs to be done in order to go totally paperless. He understands this stuff better than anyone. So despite decades of research, this is what his research is telling us, that health information technology to improve patient care has been really slow. And we just described that a moment ago. And the reason? The critical reason for slow adoption is the poor usability of clinical systems. Okay, the information that is least frequently stored in the computer are your dental history, your medical history, your treatment notes, your chief complaint. You know, this study just reinforces the need to apply cognitive engineering methods to support the user interface for electronic records. So this is the relational information. This patient-centered information that we need is not being supplied, but now hopefully we have the capability, as you will see with C Notes when I show you how it works. So we're just going to give you a little bit more of this, you know, putting this kind of data in, this relational information, you know, progress notes, treatment notes, chief complaint, medical history, that's pretty an arduous task, because it means that we have to type. Oh man, I can't stand typing. I'm a hunt and pecker, is what I am. So advances in data entry, what kind of techniques have they created? Well, you know, they have rich text format. You go into any practice management software, and where you type your notes, that is called rich text format. That is nothing more than a computerized typewriter, rich text format. It's one step lower than Word, and it's one step above a typewriter. So what we create is an interactive, it's an interactive device. So the PDF that's created. So we have the rich text format. We also have templates. How many of you guys out there are using templates? Anybody? Give us a little view. A couple of y'all, good. You know, templates have their own issues, and we're going to talk about that. The other thing is dictation, okay, which is actually, as much as they have tried with Dragon and everything, when it comes to dentistry, I've tried Dragon many years ago, like 5 years ago. It was difficult. Once it even learned what it was doing, because once you dictate the note, then you have to go back and hunt and peck and edit and make it, you know, the way you dictated it. So it's still a big issue. So RTF requires a lot of editing. Templates actually require a lot of editing, but we're going to get into that because most people use templates, and we're going to share with you why you shouldn't. So what information do we expect in a chart? There's something called the BDR, the Baseline Dental Record. And what is that? Well, Titus Schleier, what he did was he created something called a baseline dental record, and he recommends that every practice do this. Now, what is a baseline dental record? It's a superset of about 20, 23, 24 items that what dentists really actually want in their chart to make it relational. And you can see he's got a list. If you look at this area chart right here, you'll see on the left he has appointments, he has treatment plans, completed treatment, oral health status, intraoral images, extraoral images, diagnosis. And what you see is the green area of the chart is showing you what is primarily placed in a computer, in a practice management software. In the dark blue, it's telling you what is primarily placed in paper. And you can see the paper still far outweighs what's happening in the computer when it comes to chief complaints, progress notes, medical history. The blue that you see, the sky blue, is a mixture of both. So we are seeing that people and dentists are keeping their information and practice patient-centered information in multiple places, which can be a problem. So most dental practices store patient information with a mix of paper and digital formats. A large portion of it is duplicated. And according to Larry Emmett, that creates a big problem. So you want to keep them separate if you can, if you're going to do that. So keeping information in multiple places has its drawbacks. Number one, it consumes unnecessary resources. It becomes inefficient for your office. You wind up wasting a lot more money than you actually think in intangible sources. So it can cause incomplete diagnosis, incomplete treatment plans, and clinical errors. When you say, where's the note? Well, I thought Susie had it in the chart. Well, no, I thought it was in the computer. And it's in neither place. So that kind of thing can also cause major legal complications. So why the inadvertent duplication of information? Well, the primary response in his study was doctors would say, I'm in transition. And then the other big one was that, that their PM software was simply inadequate. So getting back to transition, they're saying that, well, I want to go paperless, but for the time being, I'm kind of transitioning. Now that transition could take upwards of 10 years maybe. We don't know. I'm in transition too. So I've been transitioning for at least 15 years now. Anyway, so my practice management software, for me, it's one of the reasons why we built C-Notes is we looked and saw what in the baseline dental record was not being met in our practice management software, and it became an area of great concern for me, because if you've ever been sued, your heart stays in your throat for 9 months until a verdict is rendered, and it's always in the back of your mind, and it's really no fun. I've been sued before. Fortunately, I've won, but it is really, it's like getting a heart attack. You don't want another one, that's for sure. So anyway, the study of these results by Dr. Schleier is today's EDRs, they just don't mirror the information content of paper records. And remember, paper records, excuse me, are tried and true. I mean, we've been having paper records for over 50 years, or even more than that. So, it's that is tried and tested, and we know what information we expect out of a paper chart. So in order to get that in a relational sense in computers, it's a hard thing to actually do. So let's look at a BDR. And right here you can see BDR in the left column, practice management software in the middle, and paper chart on the right. And these are some of the supersets that Dr. Schleier talked about. Number one, registration, which can be found in mostly in your practice management software. Appointments. Appointments will be found primarily in the schedule of your practice management software. Treatment plans. Treatment plans are generally in the ledger of most software, practice management softwares. Completed treatment, you will be found also in ledger. Intraoral images will be found in attachments of most practice management softwares. And radiographs will be found in attachments. Charting. Charting has come along a great deal in the recent years. Most practice management softwares do a really good job of charting. And C-Notes does not get into charting. Very, very, very little. It's not what we are about. We're about writing a note. Now we can write a note about charting. Alerts and forms, they'll be found in forms in the practice management software. Oral health status, mostly found in a paper chart. And what about diagnosis? Almost always found in a paper chart lately. And then radiographic findings, even though the images, the radiographic images are found in the practice management software, the radiographic findings are actually found in the paper chart. So you see the disconnect here? Examinations, you will find in notes. Dental history, when you record dental history, is probably in the paper chart. Then also the medical history update forms are in the paper chart. Medications update, and we'll go on and on and on. Prognosis, which is really important for patient care. Prescription records, and we also have consultation discussions, which are very important. Prognosis and consultation discussions inform consent. We're going to talk tonight about consultation and consent, because that is really one thing that C-Notes does extremely well. And it's also part of one of these 3 secrets that I'm going to give you tonight, because it's about getting the patient to say yes. So prognosis is really important, because if you don't have a proper prognosis, there's a good chance that when you get audited by your insurance companies or your HMOs or PPOs that you participate in, they're going to be asking you for a check, is what they're going to do. Because how do I know? I've seen it happen to some of our clients where where what's happened is they get audited by Medicare, and they actually find that certain treatments were, I guess, illegitimately paid when they shouldn't have been, or they claim so. And then you have to go there, because you're being audited, and you have to present your notes. So if they find any reason not to pay you or to ask for their money back, one particular dental office had to reimburse the state about $6,000, and that was in 1 week. Now, how many of y'all can part ways with $6,000 in 1 week for something that was done? That could be quite painful. So it's very important that we get C notes to integrate with what you're doing in your everyday practice. Now, I don't mean integrate with PMS, with practice management software. I mean integrate into you actually writing these detailed notes, so you will be sleep better at night. You don't have to worry about whether or not you're going to be harassed. You'll be proud of your notes, and you'll be knowing that you're taking better care of your patients. So the promise of technology, incorporating, according to Dr. Schleier, if you incorporate more BDR categories into the electronic dental record to better mimic that good old paper chart, you will allow practitioners to get closer to fully implementing a completely paperless EDR in the practice. So that is really what paperless is about. It's not about whether C notes can be integrated into your practice management software. It's really about going paperless. You need to increase the BDR categories, which actually what C notes does. So everybody got that? It's okay. Get a good high five on that one. All right. So let's talk about template writing real quick. And in a moment, we're going to get just a couple more minutes doing this review, and we're laying down the groundwork, and then we're going to get into C notes and show you how we write notes with it. And hopefully you'll enjoy it. Let's see, template writing. Did we put out that survey, Scott, about how do we write our notes? Yeah. Any results? What are our results?
About a third template writing, about a third by hand, and about a third.
There you go. A third by hand, a third template writers, and what was the other one?
A third digitally.
Digitally, good. The Hunt and Peckers, those are the rich text formatters. The RTFs. So anyway, let's talk about template writing real quick. So what's the problem with template writing? Why do I bash it? Well, it's because there's a legality issue with it. And simply put, templates are not a reflection of what transpired between the dentist and the patient. That's a big issue. And when we get into what legal defense consultants and counsels, what they say, here's three of them, three big ones that are in dentistry. One of the major causes of malpractice suits is poor or incomplete notes. That's from Don Morse, legal defense consultant. Then you have Jeff Tonner, a malpractice attorney, who just wrote an article in Dental Town. You can pick it up. And he is very active in the dental community. In fact, he has a product to do with something like this. Anyway, more times than not, the dental chart fails the dentist, is what he says, instead of being the opposite way around. And Robert McKenzie, a dental malpractice attorney, very prominent when he says, if well maintained, the chart should constitute the strength of your case, not your weakness. So all these guys are identifying. Now, one of the things that Jeff Tonner will talk about a lot is the fact that template writing often misguides the dentist into thinking that they're writing the proper information when it comes to lawsuits and litigation. It's actually not. And there's a couple of reasons for that. The serious issues that are raised ethically with regards to template writing is credible. Did you actually write, first of all, did you write the note? Number two, the accuracy of the note. Did you actually do all these things? And that's the big thing. What will happen in a court of law is it becomes a primary question in a legal deposition. If say, for example, a lawyer is deposing you and he sees these beautifully typed notes, he's going to ask you, how do you write your notes? And you're going to say, oh, I proudly do it with templates, you bow up your chest and say, I do it with templates. But the issue here becomes, well, he's going to go line item by line item and ask you if you actually did those things on the patient. And he can also grab other charts from your practice and compare notes and see how similar they are. And he's going to blow your case right out the water. So that's the problem with template writing, and we don't recommend it. So here's the other thing about template writing. They're extremely labor intensive. For example, if you were to write a template for, let's just say something easy, like veneers, you're doing 10 veneers, and you're going to write a template for it. How much information do you feel is legitimate that you need to record in order to have the template work? I will tell you that there are between 60 and 80 steps when it comes to veneers that you should be recording. And but do you have the time to actually create all the prompts that's required for this information? Are you going left? Are you going right down the veneer road? Did something happen? So once you build one, they always say, oh, you'll understand the concept and you'll love them. Yeah, if you build one, building that one could take you a month to do. And when you look at dentistry, dentistry has just, just tons and tons of treatments that can be performed, and all the little nuances have to be taken care of if you want to write a solid template to work with. So that's where C-Notes comes in, and we'll talk about that in a little bit. So malpractice, you're going to contend with 3 to 5 legal issues in your career, and progress notes and consent forms are your first lines of defense. Absolutely. So it's very important that your consent forms are there, because as Scott always says here in the office, one of the first things that hits the judge's desk in a lawsuit are your consent forms. Where are they? What do they say? And how do you even know what to put in a consent form? Can you go download them off the internet? And if they do they fit you? Even customizing a consent form would take a long time. But the great thing about C-Notes is C-Notes will actually customize it for you. So what I recommend is that you practice proactive malpractice prevention. What does that mean? That means your mantra, and I know y'all are saying, come on, man, really? But listen, this should be your mantra. I don't worry about getting sued. I plan for it, because it's going to happen. It's going to happen to y'all eventually if it hasn't happened already. And generally it's really about money, why they're suing you, or they're upset with you for some stupid reason, or they no longer like you, whatever. But you can plan on getting sued. It'll happen throughout your career. So let's talk about informed consent real quickly. The disclosure is very important. Now this is from another medical malpractice attorney. He said disclosure is very important, and the patient must be told in detail regarding the nature of the risks, the benefits, the alternatives, and the complications involved in every recommended treatment. That's why in C-Notes what you're going to see is that you're going to have the capability of writing a consent form for every treatment that we have, which is all of dentistry except for sleep medicine so far. We haven't written anything for sleep medicine. So come on, really? Yeah, you have to do consent forms. It's very important. But the consent forms, as you're going to learn, are part of the 3 secrets. And because we're going to use the consent form to get that patient to say yes. And when you get that patient to say yes for minute behavioral patterns, all of a sudden saying yes to a big treatment is not an issue for them, because you have to get the patient to say yes. If it's anything you've learned with some people, is you have to get them to say yes to small things before they get to say yes to the larger things. It becomes easy for them. So we have these ads that you'll see. Bridging the gap. You'll see turn thoughts into EDR with ease. Human interaction with technology makes dentistry easier. All these things that we're talking about are basically cognitive engineering methods. And like I said earlier, I believe that the ultimate goal of dental technology is to reduce the complexity of daily activities. We're trying to do it in composite, we're trying to do it in implants, we're trying to do it in veneers and everything today, and we're trying to do it now. We're going to simplify your life with regards to note writing. So here's our famous picture. with the three guys, and these guys right here, these guys are the cognitive engineers. This guy, Scott, he's the brainiac. This guy, Jorge, he's a brainiac. This guy on the left, he doesn't have a clue. You know, I hang on their coattails when it comes to this stuff. So, but I can imagine it. So let's talk real quickly about care versus commerce. We're almost finished, and we're going to get into showing you how C-Notes works. So care versus commerce. What is this? You know, it is what it is. As dental professionals, our obligations to our patients are really more humanitarian than they are a for-profit motive, although we talk all the time about making more money and wanting to make more money, and it's your right to make more money. And one of the things C-Notes will do is it's going to save you time, and that time that is saved you can use to do what you want to do. And one of the secrets I'm going to tell you has to do with the time that you save. That's part of the $100,000 plus Pearl I'm going to give you, and it's also part of one of the 3 secrets I'm going to tell you. So it is what it is. So a challenge to our professional integrity, yes, because we would like to be better than, say, Burger King or McDonald's or anything else that asks for your money, and they provide a service, you know, fast food service. But for us, we're held to a higher standard, and that is why we are slow to, when it comes to talking about commerce versus care. You know, can we ride that, you know, that in-between place to make it smooth for us, where we can be profitable, we can provide for our family, and at the same time, we can give a high standard of care? The answer is absolutely yes. C-Notes is going to help you do that. So it's time to talk about our 3 highly successful practice secrets. And the first thing I want you to realize is, if you haven't done this yet, I want you to know, what is your time worth? Now, is that an hourly wage? Yeah, it absolutely is an hourly wage. And if you figure out that your hourly wage for an average dentist is about $300 an hour, you're about right. I will tell you that my hourly wage is about $750 an hour. Okay, that's my hourly wage. I will share with you how to get there. Now, you got to realize this is only the beginning. I can give you a Pearl, and you can put it in the back of your head and say, yeah, that's fine, Johnny, but how am I going to implement this? To implement this stuff takes a lot of work. It doesn't just happen overnight. So if you talk to Bruce Baird at the Productive Dentist Academy, if you don't know him, get to know Bruce Baird, B-A-I-R-D, Google him at the PDA. And the great thing about Bruce is he's going to tell you, if you ask him, one time we were at a continuing education course together, and we're sitting there having a drink one night, and he says, he just asked me out of the blue, it's the first time I ever heard of this, you know, Johnny, how much, what's your hourly wage? What's your time worth? And I actually knew it, but so I was surprised that someone had asked it of me. And what he proudly said was, after I told him, I think at the time mine was about $600 an hour, but now it's a little bit more. This was 10 years ago. And he told me 10 years ago it was $2,400 an hour. It's like, wow, Bruce, that is amazing. What in the heck are you doing? So if you want to learn what he does, go to the PDA. Bruce, I gave you a good plug there. Anyway, the next thing you have to do is find out what your time is worth. Getting back to time, the ability of your time. If you figure out that, hey, I'm just an average dentist and I want to increase my time, you know, your hourly wage, figure out how to do it. Raise your fees, get more patients. But if you concentrate on your hourly time and what it's worth, and even if you say you want to artificially inflate it, eventually you're going to get up there. So work on improving your hourly time, and you will have a successful practice. Okay, second thing, become a master of your business. And what does that mean? I don't want you to work in your business. I want you to work on your business. And I trained with a guy by the name of Chet Holmes. And Chet is passed away a couple years ago from leukemia, but he was brilliant. He has a book that was called, I can't remember what the name of the book was, but his company was called Business Breakthroughs. And I trained with Chet a great deal and spent a lot of money outside of dentistry learning about how to master my business. And one of the things he used to always say is, Johnny, you've got to work on your business. I want you to spend an hour or two a week not seeing patients, working on your business. strategizing. And he said sometimes it could just be one little thought that you have that could be a game changer that could make you $100,000 in the next year. It's just the way you think about your business. So he also was famous for saying that you don't become a master of something by doing 4,000 things. You become a master of something by doing 10 things 4,000 times each. That's how you become a master. So what I want you to do is to become a master of your business. Treat your business as important as your patients, and you will become highly successful. And the last thing to a highly successful practice is, what is your patient funnel? It's like, what's a funnel? A funnel is I hate to use this word, but it's a sales system. It's a way to get your practice, to get your patients into the practice and how they work. Now, it's not just an advertising funnel. There are such things as advertising funnels, but there's also something called a funnel, a structure funnel. And the great thing about funnels in dentistry is they recycle. What do you have? You have continuing care appointments, hygiene appointments, these kind of things. And what the great thing about these funnels is, if you create a structure, or as I learned this stuff from Dick Barnes. So if y'all want to give a plug to the Dick Barnes group, if you learn how to create a funnel or a structure and get the patient to say yes, you know exactly where they are in this funnel. You know when they're ready to say yes, and when you can increase and have a highly successful practice. So those are the goals I want you to commit to. Tell me you're going to commit to them. Promise you're going to do it, and you will have a successful practice when I see you, a more successful practice, I should say, when I see you next time. So it's time to write some C notes. Y'all ready to write some C notes? When you look at C notes, don't be intimidated. Most people call us right after they get it, or we get some nasty emails often saying, this thing's not doing what I expect it to do. And so certainly I will tell you that C notes works beautifully. Even myself, it took us 4 years to write this, to get it to where it is. We continually upgrade it, and we continually improve upon it. We also depend upon emails from you and to tell us what you like and don't like. And we will constantly try to strive to make it better for you. So let's go ahead and get involved in C notes. So let me do this real quick. It's going to take me just a moment. See if I can do this right. That's not right. Was that it? No. There you go. Right there. We're going to start a little different screen share. There we go. So we're opening up our C notes. This is our simulator. We can't do it on an iPad, so we're doing it on our computers. And this is a simulator that we use to do our work. So this is the screen that you'll first see with C notes. And what you have to do for every patient is type in the patient name. So we'll just put, I don't know, we'll put Bob Rowe. I don't know who Bob Rowe is, but initials of the person writing the note. And we're going to reason or chief complaint. So you can see how immediately we make you type in the chief complaint or the reason for visit. Insurance companies want to see this. It's really important that it's in every note. Even if it's for a cleaning, it's the reason for the visit. If they have a chief complaint, then you talk about it. So today we're going to do something really interesting because, I'm going to go across different departments, but we're going to do an extraction. So I'm going to type extraction, and we're going to do tooth number 8. We're going to do a bone graft. Okay. And we're going to place an implant. Excuse me while I hunt and peck. So we're going to place an implant. So when we hit return, you'll see the departments of dentistry. And we're going to move those around. And to show them to you real quick, examinations, operative dentistry, endo, prosto, ortho, hygiene, pedo, facial aesthetics like Botox and fillers, We have TMJ, TMD, oral surgery, implant, and perio. So let's go ahead to oral surgery because that's where first thing we're going to do. We said we were going to take out a tooth. So number 8 is going to come out. So let's go to oral surgery, and you see a treatment selection screen gets open, and we're going to go to tooth removal. So you have emergency situations, you have endodontic surgery, orthodontic surgery, prosthodontic surgery, oral pathology, periodontal surgery, and bone grafting. So let's go to tooth removal. Press 8 and hit done. Now, another thing that we can do that's interesting is we're going to be doing a bone graft also. So I'm going to go back in here and I'm going to press bone grafting. And you can press 8 if you want and hit done. And one last thing is we're going to do, now I'm going into a different department. I'm going to press implant and we're going to put implant placement, 8, and done. So now you see I went through 2 departments. I went to oral surgery and I went to implant placement. And so we're going to start out with tooth removal. It's the first thing we did. So let's go to tooth removal. And you can see a pre-op screen. So we're going to click on pre-op. And we're not going to mark the conditions. Let's say they're previously done. This is what we're doing today. It wasn't an emergency. It's already been planned. We're not going to go into conditions. Let's take the vitals since we'll be doing something like this. So we're going to say it's Bob's in good shape, 120/80. And it's a little anxious today. We'll put in a heart rate of 65. We're going to commit the vitals. You see the little toast that pops up there, and you can see that it's a confirmation that your note is being written. So let's go to review med history. In review med history, we have no changes. You can go by department, but we're going to say no changes, and we're going to record that yes, there were no changes in the medical history. Very important that you do that for almost every appointment. Bob's going to be pre-medicated with some antibiotics. We gave him some amoxicillin, and we're going to give him oral sedation, just some Ativan. So he's pre-medicated. Any pre-op records? We didn't take any pre-op records. We already have those. Pre-surgical management. Okay, we told him about plaque control techniques. We're talking about atraumatic brushing technique. We have anatomic concerns addressed. Any systemic concerns were addressed. Chlorhexidine rinse. Surgical template list. No frenectomy. We're going to have given him antibiotics and analgesics already. So just a pre-surgical list, and you can see how it's running. Let's give him some anesthesia. You can record no anesthesia if you choose to, but we're going to press on topical, benzocaine, and you don't have to do a quantity because you're just going to apply it to a cotton swab, and we're going to hit save. Next thing we're going to do is do local infiltration, and let's do, say, lidocaine, 1 carpule. Let's say 1 1/4 carpules, and hit save. You see how it writes. Then we're going to do local infiltration also, but we're also going to, let's change, we're going to say Septicaine, and we're going to use 1/2 carpule, local infiltration. So there we go. So now we're going to click off of this. You'll see it goes away. And next down here, supplemental information on treatment, preliminary impression. No, so we're going to close that out. Now, patient consultation, informed consent, we're going to go through in just a little while. But let's talk about, we're going to do we have traditional extraction, atraumatic, or impaction. So we're going to do atraumatic because it's an anterior tooth. So let's, we'll go here, and when you see this little icon, this little molar icon, that's going to tell you to pop this screen where we just hit teeth, where it says next to close, it says teeth, and you can see what we affectionately call the grill. So the grill gets popped, and we're going to put tooth 8. This is telling the note that you're selecting a tooth. It's going to write a note about tooth number 8, and it'll mention it. So that's the tooth that we select for removal, first of all. And let's say, did we raise a flap? Yeah, let's raise a flap with a scalpel. And did we do a tooth sectioning? No. We do a periodontal attachment steroid? Yes. Did we detach the ligament? Yes. We did a purchase creation, and then we elevated, and we used some apical retention forceps. So we're going to press save and save all that information. And we're not going to do a soft tissue flap closure. I mean, you could if you want to at this time, but we have other things to do. So if we're just doing extraction, you want to do that. If you had complications to an extraction, you can look at that. So let's close out, because we're not going to go there because we have more things to talk about. So there we go. If we went to go finish, you can see where finish is, make sure everything's okay. But we're not going to do that just yet. And follow-up appointment, that's for another appointment. That's for another note that we're going to write. So the next thing we're going to do is place a bone graft. So we went through pre-op already. You can see it's identical. So we're going to close that. Patient consultation, we're not going to look at. Socket preservation, which is what we're doing. So we're going to say we're going to add a socket preservation. Now, one of the things that I like to do, I learned from R.M. Garg, when it comes to implant placement, we're going to measure the root length. And we're going to say it's, let's say 11 millimeters. So we'll save that. What kind of defect did we have? Well, we had a 3-wall defect, and we'll save that. And now we go up, and did we deride the socket? Yes, there's more than one place to do that, to write that, and you can write it multiple times if you want. So, did we raise a soft tissue flap? Yeah, let's say we raised one to place the implant in the graft, and we use an envelope. We can save that. You'll see it pops it, the toast. The incision was, let's say, a crestal, palatal crestal, and we did a papillary sparing technique. And we might have even done a relieving incision. So we'll do that. And the dissection, it's a full thickness dissection. Did we use a membrane? We're going to say no. Bone graft materials, let's go to bone graft materials. We use allograft. We're going to use the FDBA, and we're going to reconstitute it. And let's say we just reconstitute it with saline, but we have methyl cellulose if you want, or lidocaine. PRP if you want to use it, or if you are using it. So the graft material. So did we place the membrane over it? No. Do we fixate the membrane? No. So we close out. Okay. The graft information. So let's say we write in, I don't know, we could write in, excuse me one moment. There we go. Let's write in, I don't know, let's write in Zimmer. The Zimmer graft material. Lot number, QEDG, and we're going to write an expiration date. Now, what's so interesting about this is that it's very important that you write this down, because it could be a recall, could be actually what's happening in the future, like as soon as next year. I have learned from certain companies that you're going to have to write these things down and report them to, once again, the powers that be, you know, in DC. So anyway, flap reposition. No, we're not going to do that just yet. Are we going to close it? No. Surgery complications. No, we're not going to go that. So let's close out. Let's go to our implant placement now. Pre-op is identical, so you can skip that. So you've seen how we write this. Implant selection. Well, let's do some measurements. What's our depth? Let's say we're going to say it's going to be 13 millimeters. And what is our width? 13 millimeters. I'm sorry. Let's use let's say 4.5. And so we hit save, and let's go to implant guide. So we're going to hit 8. What implant system we're using? Let's use Megagen. I don't know. I'm just throwing something out there. AnyRidge, and platform diameter. Let's say it's 4.5. I don't even know if that's the proper ones. The length, let's say it's 13. A lot number could be something. And our expiration. Sorry, I did it backwards. And reference number if you have one. So these are the things you want to record, and they're on the package, so it's really important to do that. Now this becomes important because this will become a part of your note. So you can see how beautiful it is. So let's go ahead and close that out. So surgical guide selection. Do we do CAD/CAM guide? Do we get a lab fabricated guide? Let's do an IT jig. And let's say it's, you know, either you can do partially, completely, or non-limiting. So we're going to go ahead and press that. Now let's close this out because we finished there. Notice how C-Notes reads left to right and up to down. It kind of tells you what to do. So let's, we talked about, we did a envelope. We already recorded that. Incisions, we already recorded that. Let's go to the dissection. We already recorded that. Let's go to the bone grafting materials. We already said that if we're going to bone graft. So implant insertion, let's go ahead and do that. Surgical guide. So we place the guide. Notice how when I'm in this screen where it says surgical guide, that's an activity screen, and we're going to save often is what I normally do. So once I go through a button on the left, once I complete the treatment selections, or the activity selections rather, I will then take and save. So let's say we used a manual torque driver and a surgical driver, and hit save. Location, the final location of the implant we're going to say is level with the buccal bone. Our final tightening was to 45, so you can go up to 70 if you can crank it that hard. You want to record that you confirmed with an x-ray placement of it, and if you place sleeper implants you can even actually show where. So let's close that out. We're finished with that, and let's go to finish, and it's a two-stage. We can place a healing screw. We can also do a delayed function, or you can do immediate load. But we're going to do that, and we're going to replace the flap. So replacement, let's do a tension-free verification. We smooth the edges. We didn't deepithelialize the host papilla. Let's say we coronally reposition, since we had those releasing incisions. And if you want, you can even put Decadron. So there we go. And soft tissue closure, let's put sutures. We'll write Ethicon maybe. And I'm just going to write something like Vicryl. I don't even know if they're from the same company. Lot number, and then expiration date. Notice how these expiration dates are so important. Got to have them. And so now we're finished there. If there were surgical complications, you can record them, but at this time, no. So now we're going to go to, we've finished our tooth removal, we've finished our bone grafting, we've finished our implant placement. Let's go to conclusion. So conclusion, notice is here in the upper right corner. And there's also something very nice, this little icon next to it, the triangle with the exclamation point in there. Let me close this real quick because I'm going to talk to you about that just for a moment. This is the broken appointment or unexpected incidences button. If the patient didn't show up, you can write a note, simply go through all the things, you go straight to this note, to this triangle, and hit broken appointment, and you can do that. Then you can write what unexpected incidents happen. So if there's any kind of unexpected incidents, that's something out of the ordinary that you should record, you can write it here. In fact, we have a video on it on our YouTube channel. So you can see how things look. If we go to conclusion now, post-op instructions, let's say we gave post-op instructions for oral surgery, and we did verbal and written on bone grafting, extractions, and implant placement. And what about adjunctive? Well, we also did verbal and written for local anesthesia and for oral sedation. So we go ahead and press that. Any meds we want to give, or if you already gave them, you can already give them, but we have topicals, antibiotics, antimicrobials, and narcotics, but according to our list, our pre-check list, we already gave that to them. So next appointment will be for, we'll say oral surgery, or if you wanted to say, you can also go to implant, and we'll just say implant assessment, 8, no, it's for follow-up. Follow-up here in 1 week. And we save. And you can see next appointment, 8, post-op follow-up in 1 week. So we close that out. Now we're back to the final finale. Let's review the note. Now look what you see down here at the bottom. I'm going to double click on it, actually single click, and there's that interactive PDF document that you can't get in a rich text format. We can create these things, and this becomes integral part of the note. And just to click off of it, and here's our note: extraction 8, bone graft, implant placement, just like what we said, what we typed in: tooth removal, atraumatic extraction, bone grafting, socket preservation, implant placement. I pressed on surgery complications, but we really didn't have any. If you wanted to edit that, it's real simple. We hit edit, the little edit button on the upper right hand corner next to print, and we can actually go here and simply eliminate that. And this is how you edit your note, and then we can end editing. That's how you edit your note when it comes to your final note. You want to do any editing in here before you send it off. This little icon on the right side is is your email. This is what you do with I don't know if y'all can see that. Y'all can't see up above can you see the review note? You see that, Scott? You see that? Okay, good. Because I have a little green line running across my screen at the top telling me that I'm on screen sharing. So good, you can see it. And so this is what a typical note would look like. I'm going to scale. Notice we have tooth removal, pre-op, atraumatic extraction, then we have bone grafting, socket preservation, we have implant placement, implant selection, implant insertion, finish, we have flap replacement position, we have post-op instructions, and we have next appointment. Now that is a well-written note. Now I will tell you, once you learn to navigate C notes, and promise me this, that you learn one pathway of something that you love to do. It could be a filling. It could be a single crown. It could be placing an implant, just like what we did today. But if you learn one pathway tonight, I want you to promise me that you're going to do it over and over and over until you can write that note in 2 minutes. And when you can write that note in 2 minutes, you know that you have now mastered that pathway for C notes. And this is what you can see, that C notes is a very large application, and it takes a little bit more than just jumping into it, because you're going to make mistakes and things like that. But just remember, they read left to right, treatments, procedures, activities, and they also go up to down. Once you finish a screen, you close it out. If you're in that treatment screen, that's where it's primarily the half bottom of the application, you want to save often. So you can see what it looks like. Very nice, well-written note. And so that's how C notes looks. So let me get back to, we're almost finished. Actually, it took a lot longer than I thought to go through what I wanted to. We have a few more things to do. So let me go ahead. I'm going to get back into the lecture real quick. Oh, let me show you one more thing. Let me go, I'm going to go back to this. I'm going to close this out. We're going to close it. And in the clear data, you see clear data on the upper left. You go ahead and clear the data and clear the progress. That starts a brand new note. So I'm just going to type in anything right now for speed's sake. We just want to get into the app, even reason for visit, anything. So we're going to hit done, and we're going to get in. What I'm going to do now is let's go through a consent form real quick, because that is so important here. And then we're going to, I'm going to give you a little offer tonight. In addition to our bonus to a CE credit, I'm going to give you a good bonus. And we're going to make you a great offer. And it's a special offer. It's only for tonight's viewers, because we thank you guys for coming and listening to us. And we want to make sure that that you get C notes and really enjoy it, and you use it to its fullest potential. So I'm going to talk to you about that in just a moment. But let's go to, let's say veneer. And let's do multiple veneers. And let's say we do 8 tonight. And we hit done. Excuse me. Now, what I'm going to do is go straight to consultation. This is the beauty of the consultation. You don't have to, how many times do people record consultations? What you basically say, consulted with patient about veneers, about cosmetic consultation, something like that. And that's all it's said. But really, what you need to do is record what y'all talked about. Now, what's so important about this? So, first of all, you want to record who was present. So the patient was present. Let's say their spouse was present too. And notice you don't have to hit us. There's no save button. It fires. If you don't see a save button, it'll automatically write the note for you. So proposed prosthodontics, we'll say veneers. And so you can do this real fast. Now, what's interesting is you can actually use this as a teaching tool for yourself to learn how to give a consultation if you want to. So the reason for the prosthodontic treatment we talked about, we're going to talk about aesthetics, and let's say failing prosthodontics. And so local risk factors, let's see, it could be poor oral hygiene, lack of professional cleanings, could be failing restorations, could be severe wear, let's say. And let's go to systemic factors. Let's say there's none in this particular patient. What about treatment options? We talked about veneers, we talked about no treatment. What about prosthodontic treatments, the purpose? Well, let's see, we want to improve aesthetics, we want to restore tooth strength and restore function. We go up Treatment discussion, we talked about treatment of the clinical crown. We talked about treatment of prosthodontic outcomes, healing times, treatment sequence, temporization, length of the appointments. These are the things you got to talk to the patient about. What about operative risks? Let's say it could be some swelling from the anesthetic. There could be, what else? Discomfort, hypersensitivity, and let's say also there could be some post-op pain. I knew that was something I was missing. And so non-treatment risk. Well, you could have an aesthetic compromise, you have a restorative compromise, and you could even have maybe psychological implications. So you want to tell them that it may require retreatment. It's not a perfect world. And also it may even require an alternative treatment. So alternative treatment therapies could be non-treatment, could be extraction or extraction prosthetics. So let's say non-treatment. So we close that out. Now, why is that important? So you just recorded what you talked to your patient about. But here's the great thing. We now click on prosthodontics, and we're going to put this as the patient's name, and this becomes your informed consent. Now, what happened was while we were pressing those buttons in consultation, the application is actually writing a customized informed consent for you. Now, what's so great about this informed consent is now you have the opportunity to accept, decline, or edit each one. Let's say we accept it. You know, who was there? Approved. Little check tells you. Now, what I'm doing is I'm sliding the phrase to the left, and when I do, it opens up these things. So we accept. So what you want to get them to do is accept each one of these, and then the secret to your sales funnel is getting that patient to say yes. If you're talking veneers, you want that patient to say yes to everything. That you say, Kay, you were informed that your pathological conditions. Yes, I was. Did we talk about the causative factors for prosthodontic treatment? Yes, we did. You get her to say yes, you get her to say yes, you get her to say yes. Because what happens shortly after informed consent in a consultation? What do we as doctors do? We talk money. And when you talk money, you get this patient to say yes. And one of the things that Dick Barnes teaches is that in this funnel, this structure that recycles, you relieve yourself from talking money with the patient. You get your office staff to come in and do it. And they will talk money. Last thing you ask the patient is have we covered everything that you need to know about in order to make a decision? You get her to say yes, and she has just made her decision. And when for example, in my case, Celeste comes in and she starts talking money with a patient, it becomes quite easy for her to just confirm that the patient's going to pay for it and how they're going to pay for it, etc. So once we go through all these exceptions to what we see, then the patient, you get them to sign it. And that is really important. And then you save the signature. And if it's a younger person, we even have Guardian on there. The date's automatically saved. So you save this out, and that becomes, if we go to conclusion and review note, there is your patient consultation and with the consent form. Now, the consent form is not in the note that you can see because what we were creating was a second PDF in addition to this PDF document. And what happens then is that becomes a part of the note when you ship it off. But you can't view it right now, but trust me, it's there. So that is how we use consultations and consent forms. It's real easy to do, but it gets that patient in that funnel, and that's one of the 3 secrets to a successful practice is to get that patient to say yes, get them in a funnel, get them in that structure. If they move outside of the structure, you know how to get them back in. Another thing Dick Barnes teaches is firm in principle, yet let's be flexible in procedure. So if somebody gets out, you can always get them back in. So we'll close that up. And so let me go ahead and I'm going to, let's get back into the lecture. Let's see, how do I do that again? There we go. So one moment and I'll get back into it. Did I do it right? There we go. Just one moment, guys and girls. All right, so there's our C notes. Let me get back to my keynote. So we don't have the steps to practice management integration. We're not going to cover that tonight because we're running a little bit over time, but suffice to say, you're going to send a note. The way you send a note first is by email in different ways, but I'll share with that in just a moment. You're going to unpack the note, which means unencrypted. These notes are encrypted when they go through email or however you're going to send them, and then you deliver it to your practice management software portal if you want to go paperless. So in order to get it killing, the best way is, what's the quickest way to transfer C notes to practice management software? Well, if you are a Mac user, and if you guys, how many out there are Mac users? Did you send out the, can you send out that, we're going to send out a little, another little poll and find out what kind of software y'all using, because that's important. If we determine what kind of software y'all using, it points us in a direction as to where we should be spending our valuable time when we are writing this in integration. So if you're using a Mac, which means you're either using a cloud-based software program or you're using Mac Practice. If you're using a Mac computer, email us and we will send you a desktop client that's called Centric. And the important thing about Centric is it's almost like instant messaging. It works so well. So I want you to do that. It removes one less thing that you have to think about, and which is what? It's good for cognitive thinking and activities. So what about PCs? Well, you have email, you have Google Drive, Box, and Dropbox. Now, the thing about Dropbox, a lot of people I've learned use Dropbox. It's a great way to ship things, but the API that we need in order for Dropbox to work with C Notes is coming out in August. So the best thing we can tell you is that you will be sending things through Dropbox pretty soon, like maybe in the next couple months. All right, so that concludes what we have for Centric Notes, and you can see how well it works. I hope you're able to impart and learn something. I hope I was going to impart something to you. And so let's talk about a little webinar special. So a C Notes pricing, just to tell you real quickly, is our regular price is $479.88. Now that's an annual rate. And our monthly subscription is about $40 a month. That's our price point for normal C Notes. But you know, we're just getting started. So what we wanted to do for our early opt-ins is we said, let's have an intro sale. So our early intro sale was to offer it at $359.88. We even gave a discount on that, and it came out to $29.99 a month. Okay. And that's our monthly rate. So that's a 25% savings over our regular price. So we've been doing that since about March, April. And so that's what we did. But tonight's webinar special, the whole thing, this discounted pricing is going to end soon as we're getting more and more adopters on board. So we're going to give you a special webinar offer tonight. And the reason is because we thank you for coming. As a special offer tonight, we're going to give you an annual rate of $287.92. Now you will never, that's a 40% savings of C Notes, and you will never be able to get this again. And as an extra lock-in special, I've decided, because you guys are early adopters in this, we want to give it to you for life. That's 40% off every year for life. It will never go up from $287.92, even if we increase our fees. So if you lock in tonight, and that's the only time we're going to have it. So C Notes will never be this low again. You know, we're going to do this for the first probably 500 clients, and then that's it. And so we're anxious to get C Notes out there to everyone, and because we know how good it works for us. So what are you going to get for this $287? Well, you're going to get C Notes one-on-one for 1 hour. Okay, that's going to $650 value. We're going to spend 1 hour with you on the telephone, making sure that you are up to par working with C Notes when you get it. Secondly, we're going to give you a C Notes masterclass. This is good for 8 CE credits. It's 8 hours of credit, and it's going to be 1 hour a week for 8 weeks, and we are actually starting it next week. So if you have it, we would happy to, and it's webinar format, so it's no big deal. You just like what you're doing tonight, and we'll teach you, it'll be a little bit more interactive, where you can actually ask us a little more direct questions. So also, you get the C Notes app, which is a value of $479.88, and then we're locking in at 40% off for the life of your application. So that's value is $2,569. To me, that's a great value, because we want to make sure that if you're going to invest in this, we want to make sure that you learn something, that it works for you, and that it's working well for you. And to us, the biggest stumbling block is the fact that when they get involved, I want you to remember, if you want to master it, you have to do it many, many, many times in order to get good at it. So that is our webinar offer. We have a coupon. Did you deliver the coupon to Scott? Delivered a coupon to y'all so y'all can see. I want you to do that tonight. And if you have any questions, this ends our webinar. And but we're going to be open in the chat rooms. So we hope you can join us if you have any questions. So remember, you get started for $287.92, and that's for the entire year. You don't have to worry about getting charged again. And I think you'll be in great shape with C-Note. So thank you so much for listening. And we'll be in the chat room talking to y'all. So we'll look forward to seeing you there.